distinguished ladies and gentlemen, I know my honorable minister is not here yet, so let me acknowledge the presence of my chef d'affaires, Ms. Danya, nationals of Trinidad and Tobago, visitors alike, members of the media, good afternoon. Good afternoon.
Good afternoon.
Welcome to Sovereign Soil of Trinidad and Tobago. Welcome to the Embassy of Trinidad and Tobago. For those of you who have not graced us with your presence, this is the Embassy of Trinidad and Tobago. We actually have this building one next door. It's a pleasure here to host you this afternoon. It was, without a doubt, our pleasure to say yes to hosting this event, because when one appreciates the value of an event like this and the fact that most of you came from far and wide to be here, it's our absolute pleasure. Can I see by the show of hands who is from Trinidad and Tobago in this room, please? Higher, higher. There, higher. Any other Caribbean nationals in the room? Jamaica. Who are the Jamaicans in the house?
Guyana.
Welcome, Guyana. Welcome. Barbados, welcome. So essentially we have Caribbean presence. Any non-Caribbeanites in the house? Guadeloupe. You can see part of us. Haiti. Oh, welcome, Haiti. Tanzania. Welcome, Tanzania. Welcome to Trinidad and Tobago. Ladies and gentlemen, you know, in my previous job, before I became ambassador, I was the CEO of a company called HealthNet. And let me just share this story with you, because I think it's very relevant to why you're here today. It's a pleasure to see that you're trying to bridge the gap between the physical, pathological, and physiological disease of HIV and bridging it with the mental aspect of it, behavioral aspect of it. That's a welcome move, simply because the behavioral aspect often feeds into the social and then the socio-economic aspects of this disease. Very often we have well documented the cause of this disease, and sometimes we really need to quantify, if not qualify, the socio-economic and other implications for society. And especially saying that this is a Caribbean group and you're able to contextualize that here at the embassy means a lot to us. In Trinidad and Tobago, HIV/AIDS, it's an issue for us. We have an estimated population of just about 24,000 people infected, at least documented. And I'm sure it may be higher. And we know it's an issue for the Caribbean. We have around about 240,000 people with HIV/AIDS in the Caribbean. And I'm sure you would have heard a lot of these statistics over the last 48 hours. But what is even more concerning is, I will tell you from my own observations in the company I was running, I saw back in about 6 years ago, it was a 45 to 55 ratio between female and male in my country, Trinidad and Tobago. And that has done an about turn. It's almost 70 to 30 now. 7 women for every 3 men. And that is a source of concern. If you look at the United States alone, the highest population, as you know, is in heterosexual and gay black men. There is a lot of implications for us in this country, right here in the United States, whomsoever you are. And we really need to work as, you know, as brothers in arms to fight this scourge in the Caribbean. And I'm not here to give the feature address, but let me, it'll be an opportunity I miss, not to really, first of all, congratulate, applaud, and say happy birthday to my Jamaican brothers and sisters in the house. Happy anniversary. August 6th, Jamaica celebrates its 50th anniversary. And for those of you who don't know, August 31st, Trinidad and Tobago celebrates its 50th anniversary. Trinidadian brothers and sisters, happy birthday to all of you. And you know, let me just say this. I would really plead to the Trinidadians in the house, and the message is also for the Jamaicans and the rest of my Caribbean brothers and sisters. Let us really use this year, especially 50. Most of us in this room may not be around for the next 50. To enjoy the next 50. And I'm not saying that to be undiplomatic, I'm saying that to be almost as a matter of fact. Let's hope I am proven wrong otherwise. But let us really use this opportunity to rededicate ourselves to the Caribbean and to our respective countries. Let us use it to rededicate ourselves to the unity and prosperity of our various countries, to the development of our people, and to the caring and the security of our nation's children. We turn 50 once. Let us use this opportunity to really pay homage and respect to our leaders, past and present, in our respective countries, and our countrymen whose sweat, toil, and effort were able to secure our own independence, and in Trinidad and Tobago's case, our own republic status. Let us use this opportunity as 50-year-old countries to really reflect and introspect on who we are. We didn't get here by perhaps. It was a long, hard, eventful journey, and this journey has no destination. This journey will never end. It's going to continue being a long, hard road with constant learning to really secure and epitomize what we cherish most, our democracy. And the Caribbean has a history. It's exemplary for democratic principles in the Western Hemisphere on a global scale. And I think sometimes we underestimate the fact that we live in a peaceful, harmonious, democratic space we call the Caribbean. Our races may be different, our religions may be different, our politics may be different, but we are all people from the Caribbean and we are all Trinidadians. And I feel very strongly about that. Our progress is our nation's progress. Our fortunes and our nation's fortunes are all intertwined. So I think it will be an opportunity on this for us not to reflect and really ensure glorious fortunes for our various countries. And we are all from the Caribbean. And I'd like to end, let me end by saying, let us not be intimidated by the smallness of our countries, but by the grandeur of our vision and the greatness of our leadership. Thank you, have a wonderful evening.
Together for the ambassador, please. Yes. Good evening, ladies and gentlemen. My name is Maurice Edwards. I'm the person who's leading the PANCAP delegation to the International AIDS Conference in the absence of my director, Mrs. Juliet Bino Sutherland. And I must apologize on her behalf that she had to leave to go back to Georgetown, Guyana today. And she's asked that I convey her profound apologies for not being able to be here this evening to address you. So I hope that I do a good job for her and that you guys will report that, yeah, you did something good. Come on, smile here, Caribbean people. Traditionally, PANCAP at the past 5 International AIDS Conference has always convened a Caribbean evening. And we at PANCAP are indeed happy that this evening that we could partner with the Danya Institute to have this evening for all of our Caribbean brothers and sisters. So it gives us great pleasure to see this large gathering here this evening. I'm your chairperson, and I don't want to spend too much time talking, but many of you may not know what PANCAP is, so just allow me a minute or two to say what PANCAP is. PANCAP is the Pan-Caribbean Partnership Against HIV and AIDS. It comprises member states, governments, civil society, donors, both bilateral and multilateral. Also, the regional institution in the Caribbean. And we focus on 4 things. First thing being that the heads of government of CARICOM mandated that PANCAP be responsible for coordination of the Caribbean's response to HIV and AIDS. So we seek to have coordination, and there may be some donors around here. Coordinating donors is never something easy. Secondly, we do advocacy at the highest level. So we take the case for responding to HIV and AIDS to all levels, to heads of government, both in the region and internationally. Thirdly, we do resource mobilization. And fourthly, we develop regional public goods and services which are more cost effective to develop at the regional level than for the individual countries in the region to spend their time and effort to develop those public goods and services. What have been some of our achievements? PANCAP was formed roughly 11 years ago. I'm told It was in February on, what's that special day in February? Valentine's Day. So in the spirit of love, the heads of government in their wisdom decided that they needed to be formed this organization called PANCAP. So we're 11 years old, and since then, in terms of resource mobilization, the partnership collectively, both the countries as well as the PANCAP coordinating unit, we have mobilized close to 1.6 billion US to fight HIV and AIDS. Secondly, with regards to treatment, in the region, in the Caribbean, more than 60% of the persons who need to be placed on antiretroviral therapy, they are on treatment. We are doing better than the global average. We are doing better. I mean, we have some gracious hosts, but it's an opportunity for us to trumpet something. We're doing better even than the US, where more than 60% of our patients are on treatment. And that is only because WHO revised the criteria for initiating people on treatment. Previously, that was at 200, where the CD4 counts at 200. Now it's at 350. If we use the old criteria, more than 3/4 of our people who need to be on treatment will be on treatment. Thirdly, in a number of the countries in the Caribbean, we have eliminated mother-to-child transmission of HIV. Barbados, Bahamas, Jamaica is almost getting there. So there's lots that we, as a region, need to be proud of. So Caribbean people, pat yourselves on the back, but don't lose focus. There is still lots more to be done. And at conferences like these, we are able to share as well as to learn. Others can learn from us, and we can learn from others. Use this opportunity to network. Tell people what you've been doing. We've been doing great work, and learn what they have been doing and how we can partner with them to help to turn back the tide of HIV and AIDS. I've taken more than 2 minutes, and so it is my pleasure, ladies and gentlemen, to welcome our first speaker this evening. I would like to introduce a wonderful gentleman, a consummate diplomat, and it was under his watch that PANCAP was birthed, and under his watch that PANCAP was able to achieve a lot of the things that PANCAP has been able to achieve. This person was there from the inception. As a matter of fact, he was instrumental in forging this vision with the heads of government of the region. And when they gave the mandate, he was instrumental in forming the directorate in the CARICOM Secretariat that was responsible for moving the health and development agenda in the region, and more particularly, seeing that PANCAP be born, seeing that the resources were there to move PANCAP forward. Ladies and gentlemen, I'm speaking about no other person than, he was once the Assistant Secretary General of CARICOM with responsibility for the Directorate of Human and Social Development. He is now being accorded the title of UN Special Envoy for HIV and AIDS in the Caribbean. Ladies and gentlemen, put your hands together as we welcome Dr. Envoy Edward Green to the podium.
Master of Ceremonies, I want to thank you for that overwhelming, gracious introduction. With an introduction like that, a speaker should just come to the podium and say, "It is my pleasure to be here, thank you," and sit. But in fact, ladies and gentlemen, we are here this afternoon because we happen to be in DC attending the 19th International AIDS Conference. And that conference is appropriately titled, Turning the Tide. It is therefore very fitting for us to try and engage in a discussion as to how we in the Caribbean could not only turn the tide, but also accelerate the pace. I came in when the Master of Ceremonies was telling you about the achievements of PANCAP. I want to say that PANCAP has been acclaimed an international best practice, but we can't rest on our laurels. We have to ensure that we demonstrate to the world that the small countries of the Caribbean could lead the way again. I say so because we did so in 1980s when, as small countries, we got together in collaboration with the Pan American Health Organization and eliminated polio. We were the first region in the world to do so. And I think that it is important for us now to use the initiative of PANCAP and its partners. And PANCAP is a partnership. And therefore, I suspect when we are finished tonight, all of you who have not before joined the partnership will become partners. Because we are about, again, to be the first region in the world by 2015 to eliminate mother-to-child transmission. But we have some steps to take. Steps that require the collaboration with all the partners that work in the medical profession, all the partners that work in the education department, in the youth departments, but in the community, in the fields, in the community, those who touch the lives and who could really ensure that we maintain the momentum. Indeed, it is important for us to recognize that we could not achieve much of the success, either with respect to polio or with respect to HIV, as we are demonstrating, without the support and the leadership of the civil society groups. And I think that we must recognize that although we make the policies, the civil society provides us with the leadership. And it is for this reason that as we move beyond this conference, we have to change the way that we structure our partners. We have to stop paying lip service to the fact that we say that we must involve the people living with AIDS. We must ensure that that happens in reality. And as the Special Envoy, the Secretary General's Special Envoy for HIV/AIDS in the Caribbean, I have one of the responsibilities to assist the Secretary General in building that partnership and strengthening the role that civil society will play now and in the future. I also feel that it's very important for us to recognize that we have a very important stumbling block in the way. And that stumbling block is the acceleration of the human rights agenda and the elimination of stigma and discrimination. Unless we move on that front, unless we do so, we could reverse the game. We have to approach this as we approach human rights generally. People are entitled to vote. People are entitled to treatment. We are entitled to respond by eliminating some oppressive, archaic laws off the books which prevent the equality and the equity of people, especially the marginalized groups. And we have to move very carefully, if not diplomatically, to try and see how we can remove some of the... I want to say that we have to give thanks to the leadership of our Caribbean countries. they have been phenomenally supportive. They have provided the political will that went to Barcelona to negotiate with pharmaceutical companies at an AIA, at an international conference 8 years ago, which resulted in the pharmaceutical companies reducing the cost of antiretroviral drugs, as it was then in 2004, at $10,000 per person. And that negotiation by our ministers and Prime Minister Douglas reduced the price to $1,000 per person. I think we don't give credit to our leaders for the things they do. And since then, the leaders have given us the support that we need, but we have to push them. And this is where civil society is important. As an envoy, I could speak, but civil society could act. And we have to ensure that the advocacy that people like me could do must be enjoined with the action of civil society to create the changes that we need and that are so important if we are to improve and to continue to be the first in achievements. And I want to leave you this afternoon by saying I feel very convinced, and I know that we have now here, as we celebrate the 50th anniversary of independence of Trinidad and Tobago and Jamaica, we can say that we will have an increasing number of partners in Trinidadians and Jamaicans that will help PANCAP and movements like PANCAP to achieve and ensure that the peoples of the Caribbean have health, wealth, and will develop in a particular way that makes us proud. Thank you very much.
Before our next speaker, I'd like to acknowledge the Minister, Roger Samuel, from the Republic of Trinidad and Tobago, for being here today. Thank you very much. We know you have a pretty busy schedule, and we appreciate you being here this evening. So, next up.
Ladies and gentlemen, you just heard the Special Envoy speak about the role of civil society in response to HIV and AIDS in the Caribbean. The next person I'm going to introduce has been someone who's been working in the trenches in civil society for as long as there's been HIV, that we've recognized HIV in the Caribbean. Many of us don't like to get into the trenches and get our hands dirty. But the next person has been working with marginalized groups that many of us don't even want to hear about, or many in our governments. Because I'm speaking to the converted here. Many of us are working with these groups. This conference is about the most at-risk population. But this gentleman has been in the trenches working with substance abusers, with persons who've been incarcerated, and with commercial sex workers. If I've missed any other group, I stand corrected. But those are the ones I know that in my discussions with him over the number of years. He's a physician by training, but most importantly, he likes to be engaged in research, because research helps us develop our policies and our programs. Ladies and gentlemen, please put your hands together as this evening we welcome Dr. Marcus Day, Director of the Caribbean Drug Abuse Research Institute, who will speak to us about gaps and opportunities in healthcare integration in the Caribbean. Ladies and gentlemen, Dr. Day.
Thank you, Morris. Good evening, everyone. Excellencies, distinguished guests. I'm very nervous. Can you believe that? Have you ever seen me at loss for words? Before I start, I want to actually acknowledge Dr. Green. Dr. Green is the gentleman I would like to be when I grow up. He is the consummate gentleman and diplomat, and he has been a mentor to me for the 15 years that I've been involved working with CARICOM, and a good friend. And I just want to, we miss you at home, but we know you're doing great work here. So thank you very much. Can we have another round of applause for that? And I'd like to echo my commitment to PANCAP. I've been working with PANCAP since its formation. In the beginning, there were some teething issues as we integrated civil society and intergovernmental organization together, but I think that we have reached a point where we see both sides, that the partnership is extremely valuable. And I think that the work that PANCAP has done in promoting the integration of civil society into the response, so you want me to say it louder? The integration of civil society into the response, and how PANCAP has embraced that and worked with us. And so from the civil society point of view, we are very, very, very pleased. I'm a founding member of the Caribbean Vulnerable Communities. It's a civil society coalition of organizations, of men who have sex with men, of drug-using organizations, of sex working organizations, and it is made up of the people of those populations who are working to better their lives and to reduce their risk of HIV. So we're very proud that this organization has moved into a position where we are the voice of the voiceless and the voice of the people who necessarily cannot always speak for themselves. So I'm very pleased to be able to be here. The topic tonight, gaps and opportunities in healthcare integration. You know, it's interesting, when we look at HIV and we look at how far we've come and we look at how far we still have to go, it's interesting that HIV has basically been a lens at which we can look at our healthcare systems and all the disparities and all the issues that we have in terms of delivering healthcare, and not just HIV care, but general healthcare to our populations. Basically, HIV has exposed those disparities, have exposed those issues that we need to correct. And in a way, we have to be thankful, because as bad as the HIV epidemic has been in the Caribbean, it has allowed us to look at where we need to fix our healthcare systems. And we are moving that way now. We have, 4 or 5 years ago, we started to look at task shifting. And we started to look at how in the beginning of the response, it was a very biomedical response. And we trained physicians in VCT. And we expected physicians to spend 45 minutes with each patient, counseling that patient prior to a test. And we realized that didn't work. That physicians, as the higher echelon of the healthcare system, didn't have 45 minutes to spend with each patient talking about their HIV risk, talking about their sexual activities, talking about their drug-using activities. And we realized that we needed to shift those tasks. And so we started to train nurses. And then we realized that even the nurses were so busy doing what they did around medicine and around providing health care that, and if anybody, let me tell you, the nurses are the sergeants of our healthcare system. The doctors, if you're not nice to your nurse, you won't get anything. And if you're nice to your nurse, everything is possible. So I've learned that, and I say yes nurse, no nurse, yes nurse, and I'm very obedient to the nurses. But it's true, and so we need to, it is true, we need to integrate more in our healthcare systems. We need to shift the tasks that are not health related, so the counseling tasks, the recruitment tasks, the tasks associated with looking, I can't think of the word, I'm sorry, looking for people. In our system in St. Lucia, we test people and then we don't necessarily contact tracing. It's contact tracing. We need to come up with contact tracers. We need to come up with members of the community. When we send our HIV nurse out to do contact tracing and she comes into the community, everybody knows why she's there. Everybody knows who she is. These are small small communities. These are not big countries where, like in America here, where nobody knows who you are. And in St. Lucia, everybody knows who Nurse Sybil's is. And if Nurse Sybil's come to your house, there must be something going on because she works in the HIV clinic. So we need to look at how we can shift those tasks. We need to look how we can decentralize our healthcare and our provision of HIV care and our integration of HIV care with our other non-communicable chronic diseases. I believe it was Guyana who just recently decided that their HIV program was now a non-communicable disease and that they were going to integrate it in with their other NCDs. And I think that's wonderful because I think that we're getting to that point where HIV, I think we should get to that point where HIV is another healthcare issue. And when we go to our doctor and we get tested for HIV, that we are given a prescription for medication and we are asked, how can we help you be adherent? If you take this one or this 2 pills, hopefully we'll get down to 1 pill a day in the Caribbean. If you take this 1 tablet a day, how else can we help you? How can we keep you on your meds and keep you healthy? And you know what the added benefit of that is? It's not the purpose, but the added benefit of that is you become non-infected. Treatment is prevention now. But treatment is, right now, people living, there's a number of people in this room who are living with HIV. And they have an open-ended life like anyone else. There is no closed end. It isn't that it was 30 years ago when it was a death sentence. The challenge now is, whereas 30 years ago, everybody with HIV would die. Nowadays, the only people who are dying are the poor, the indigent, the people who are marginalized, the people who are criminalized, the people who are in our criminal justice system, the people who live on the street, and all these other healthcare issues and these other access issues and these other disparity issues that are related to where you live and your economic position. And in some places, in America in particular, your race. You know, the HIV infection in America disproportionately affects Black Americans. And within our diaspora community, research has shown that within the second generation of our diaspora community, all the health disparities and all the issues around healthcare that relate to Black Americans affect not the first generation, but by the second generation. So this is very difficult in terms of how we can make our healthcare systems respond to all our people. You know, we have a very good model in the Caribbean, and it's Cuba. And Cuba provides, my daughter goes to school, medical school in Cuba now, and she came home to me after the first semester, and she came home and said, you know, Daddy, in Cuba, we don't even think about when we have to go to the doctor. We just go to the doctor. It's free, and whatever problem we have, we go there and we get it addressed. And they encourage us to come before it's too late. As a man, as a Caribbean man, one of our major issues in the Caribbean is our poor health-seeking behaviors of men. You know, the largest, the cancer that kills most men in the Caribbean is prostate cancer. We do not present. We can have endless problems. We don't want prostate examinations. We don't go for PSAs. We don't do anything associated with. And so what happens? We get to the point. I've been involved in a number of wheelchair programs, and in Trinidad also. In fact, Trinidad through the Rotary Club in Trinidad facilitated and gave us a container of wheelchairs just recently, which we distributed. The number of men that I saw that were paralyzed from the waist down because of late presenting for prostate cancer, by the time they went to get their operation, they basically, the only way to take out the cancer was to go into the spinal cord. So this is terrible. This is something that when you early detection, early treatment, right? How do we start in St. Lucia, I can proudly say we have 37 community primary health care centers for a population of 160,000 people. Every small hamlet in St. Lucia has a health care, has a nurse, has a visiting physician, and we have 100% immunization. The United States can't say they have 100% immunization for children. We have 100%, we have eliminated, we have not certified, but we have eliminated mother-to-child transmission in St. Lucia, and really in the entire OECS. There hasn't been a baby born with HIV in the OECS in the last 4 years, and I believe in St. Lucia we're probably at 6 years now, and Dr. Cox will probably correct me. But we have been able to deliver these services. How now do we extend that to all our populations? We have a challenge in the Caribbean when it comes to our marginalized populations, our drug users. Primarily our drug users are sex workers, men who have sex with men. In the Ministry of Health, it is our job to treat these people. It is our job to look after them, and to look after them without any regard to their station or what they do. It's our job to reduce the harm and to help them reduce the harm they do to themselves. Unfortunately, across the road at the Ministry of National Security, the Ministry of Home Affairs, the same populations that we're treating are getting arrested, especially the drug-using populations. We often have relied on criminal justice responses to solve our public health problems, and it's ineffective. Public health problems need to be solved by physicians, by the Ministry of Health, not by the criminal justice system. You know, I don't know if you realize that probably 65% of people who use substances have a co-occurring psychiatric illness. And that's not my research in St. Lucia with street drug using populations comes up to 66%. I spent a couple of days in Santo Domingo interviewing homeless, injecting drug users, a lot of them deportees from America. We had a 62% rate of people who had some contact with psychiatric services. NIDA did a meta-analysis of all the research that looked at issues around co-occurring psychiatric illness. They came up with a 66%. So it seems to me that it is basically ineffective to use a criminal justice response to a population that has a psychiatric issue, a psychiatric problem, a mental health issue. So and I don't know how much it costs to incarcerate people in other Caribbean countries. In St. Lucia, it's $2,000 EC dollars a month, and that's the cost. That doesn't cost the counter. It doesn't count the cost of the prison to amortize that over a number of years. It's just the cost of the guards and the electricity and the food. $2,000 a month. What can we do with, and drug treatment is $1,500 a month, as an example. Community mental health care. We need to integrate, every one of our countries has nursing. 3 more minutes. I can go on for hours. I can go on for days. I mean, you know, every one of our countries have nursing schools. We need to ramp up our psychiatric nursing. We need to have more psychiatric nurses. We need to have psychiatric nurse practitioners. We need to have, you know, it isn't just around HIV either. We have so much trauma in our communities. Most of us as professionals started off as school teachers, and then we moved on to other fields. So anybody who's been in a school system in the Caribbean, the levels of abuse, the levels of sexual abuse, violence among our children grow up, they have issues, they have traumas, we have very, in St. Lucia we have very poor community mental health. in Trinidad, I'm very impressed. Jamaica is another country. I'm very impressed with the community mental health. Now, the Jamaicans and the Trinidadians will say, oh, no, it's not good, it's not good. But, you know, compared to when you don't have anything, anything is good, right? I mean, I've been in Port of Spain where I've been in the homeless shelter down by Tamarind Square, and I've seen the community mental health nurse come to the homeless shelter and treat people there. And many people, you can stabilize them relatively easy. There's chemical imbalances in their brain. We give them a shot a month, and they're good to go for the next month, and they're happy. They're comfortable. They tell you, it's like I woke up from a dream. You know, when they get on their medication. How do we integrate and expand this health care for all our communities? We do good in the city. Our rural communities, we need to expand, because we have trauma in our rural communities. We have drug use in our rural communities. Many of our homes are in such fragile condition that they cannot deal with their mentally health family members. And this is why we end up having such a large community of homeless people on the street. These people, you know, we say, oh, they're zombies, they drug users, they no good, but zombies. No, man, these are psychiatric patients with huge problems that we need to take care of, we need to address. You know, I never see psychiatric patients listed as a risk population in HIV, and yet these are a very sexually abused population, especially our homeless women. You know, but even the men, I know people that I see, you know, that are HIV positive, that are psychiatric patients that, you know, for who are self-medicating, and for their drugs they sell sex, and of course no expectation of condom use at all. You know, just, you know, looking for the next rock. So I think that we have a number of challenges. I think we have the opportunity to now move to the next phase of delivering services, using HIV as a framework of how we started to deliver HIV services, how we can integrate HIV services into our healthcare system so we can deliver it throughout our healthcare system, how we can reduce the stigma associated with HIV. Now that we have, I actually will not normally disagree with Morris at all, but I think that the 350, I think nowadays the 350 limit is not good anymore. That nowadays we need to offer treatment to every person who presents with HIV. And I believe that that's where we need to move to, and we need to look for the resources either within our country or externally, but I think that we need to build up our healthcare system. If we want, to me, if we want powerful, you know, I love Trinidad. My Trinidadian friends tell me I'm an honorary Trinidadian. And if I had to move any place in the Caribbean outside St. Lucia, I would move to Trinidad. Because I feel Trinidad is the most like St. Lucia, you know, the Creole culture and they speak Creole, but they don't let anybody know that. Yeah. And I think one of the things that's made Trinidad the country, the powerful and vibrant country that it is they provide free education to all their citizens, up to tertiary level. And I think that is phenomenal. I think that all of us need to follow that model. And I think the next model we need to follow is to provide free health care to all our citizens. I think at that point, health and education, and we will rise to be the great countries that we actually are. And please, we can do it a few less, please. Thank you very much. Have a lovely evening. Thank you very much for inviting me.
You can always tell when someone speaks from the heart. And being in the trenches and being faced with responding to persons who actually need to have services, one really speaks from the heart, and one can go on and on and on. But I know you guys want to network. Just to add to what Marcus said about integration, to say that the ministers of health of the Caribbean have recognized the need for us to integrate HIV into our general services, or we want to call them primary health care services. And they gave a mandate in September of last year for PAHO to assist the region in this integration. And PAHO is one of the partners of PANCAP. In collaboration with the PANCAP coordinating unit, PAHO, with support from the US government through its PEPFAR program, did a number of assessments of the health systems in 12 Caribbean countries. And the findings that those assessments revealed, certain recommendations have been developed. Those were tabled before a group of ministers of health as well as chief medical officers. So the Caribbean has taken the policy decision to move towards integration. It has taken action to start that process. And it is now for us to ensure that the rubber actually what? Hits the road. Keep them honest. Ladies and gentlemen, our next speaker, unfortunately I don't have his bio with me, and I guess he can speak for himself. He's no other than the person who spoke at the beginning, Mr. Ryan Springer, who is the Executive Director of the Danya Institute, our gracious host. I said hostess. Danya sounds to me as though it's a female name. So, our host this evening, ladies and gentlemen, please welcome Mr. Ryan Springer, who's going to speak to us on U.S. integration efforts. Ryan, the floor is yours.
Now I know you guys are ready to eat and network. The purpose of this was to give you guys an opportunity to talk with one another and engage about possible opportunities for collaboration. So I will keep my remarks very brief. I'll try to run through this quickly. What I wanted to do though was to give you some stats. And I think this solidifies why it was so important to have this meeting this evening. If you look at the co-occurrence of mental health and substance abuse increases a person's risk for HIV nearly 12 times more than those without. 12 times increase in the risk. I think that says a lot about why we need to look at more than just HIV, but look at the integration between mental health and addictions. And there are many other stats. What I want you to do is actually take a look at the pamphlets that you have. There are a list of resources in here you can go to get data on the research around the integration between primary care and behavioral health and HIV. So I want to make sure you guys have resources, not just on the research on the information, but tools as well. There are toolkits in there as well you can take a look at. And there are many of the stats I could go through, but I don't want to take up the time doing that. But I want you to understand that individuals who are triply diagnosed are at greater risk for HIV, for substance abuse issues, and it's something that we need to take a look at. This is not something, individuals don't walk into a door with just one issue. We all have multiple. And I think that's the gist that we need to look at. And I heard our presenter today talk about the stigma. And one of the biggest issues in the Caribbean going forward is overcoming the historical stigma that we have for individuals who have substance abuse issues, mental health issues, and HIV. Imagine having all three. What does that mean for you in any of our countries? So with that said, there's a definition that I wanted to talk about. We know the stats are there. It's a serious issue. And what are all of these individuals looking for? They're looking for recovery. They're looking for a safe place to be in recovery from these issues. And there's a definition that came out of Connecticut. The director in Connecticut, Tom Kirk, he transformed the state of Connecticut's treatment system. And he ran the substance abuse system there. And they came up with a definition of recovery from working with the individuals who are dealing with mental health and substance abuse issues. This is their definition of recovery. And recovery involves a process of restoring or developing a meaningful sense of belonging and positive sense of identity apart from one's condition while rebuilding a life despite or within the limitations imposed by that condition. And what I like about that definition, this is not just a clinical definition. It's not just the absence of disease, but we're talking about a strength-based definition of being in a place of wellness. And I think that's where we need to go, looking beyond just the clinical disease, but looking at the overall health and wellness of individuals. So this is the definition that came out of Connecticut. And if you're thinking about that as what individuals who are facing these three issues are looking for, is our system giving them the adequate care? You have these siloed systems. You've got mental health on one side, you've got substance abuse on another, you've got our primary care on another. And the three never meet, in many instances. Some cases it does, and we're doing better. Here in the US, there's a big push towards integrated care, of course, healthcare reform, ACA is pushing that. But at the same time, when the rubber meets the road, as we talked about, that's not happening for individuals coming in the door in many instances. So our system, as it's currently set up, doesn't necessarily address the needs of the individuals who are seeking care. So what do we need? What we're moving towards? I talked about healthcare reform happening here in the US. And what we're moving towards is a system that's more person and community centered. We're looking at a system that's more recovery oriented, data informed, and outcomes driven. And I throw the data in there because one of the observations that I found in looking for research, looking up data on this topic, there's very little information on the intersection of these three issues, very little. And what we need to do is actually look at a way of collecting, a systematic way of collecting data, not just within countries, but across the region. At the end of the day, we are strongest as a region, not just as one individual country. So those are things that we need to look at, and I think data is a big part of it. So this is where the healthcare system is moving towards. And here in the US, these are the things that we're looking at. So given that, I wanted to highlight some major components. Okay, I wanted to highlight major components of an integrated system of care here in the US. There's some articles out there from over the years, and the common themes across all of the integrated care systems are cross-training and or relocation of the care workforce. Now there's a lot more detail I could get into on each of these topics. I won't do it tonight. You can look at the resources in your pamphlet. But essentially you have various models where they're putting behavioral health professionals within primary care or vice versa, given the policies that, that govern your land. And also cross-training. So those are the various options or combinations that folks are looking at to handle that piece. There's also improved and expanded assessments. And of course, if I walk into a substance abuse treatment facility and no one assesses me for a mental health issue or for HIV, then no one is ever going to look at that. So what we need to do is look at broader assessments or integrated assessments. The one that's being touted here in the US right now it goes by the acronym SBIRT, SBIRT. And this is used in emergency care facilities, primary care facilities to do a quick assessment around substance abuse. Also provide a brief intervention and then transfer that person to a clinic for substance abuse treatment. So you get the full package there. You get that person moving on to a door that actually offers that service. Also, person-centered care, recognizing the importance and caring for the whole person. I mentioned that in the definition of recovery. That's what folks who are in recovery are saying that they want. A system that is a one-stop shop, but we treat everyone the same way is never going to work. Every individual has their own needs, and we need to make our system, tailor our system to respond to those individual needs. And last thing, systematic follow-up. And professionals can only do so much as far as the follow-up goes. And I think this is an opportunity for individuals in recovery, for peers, to continue that engagement in the community. Because there's only so much we can do within the system. As much as we integrate it, there's so much more room for work to happen and continue to happen in the community. And what we're looking at is how can we engage communities to assist individuals in recovery. I'm going to wrap up 2 seconds. So with that said, what we're looking towards, as far as this new system of integration, there's a definition out there for a recovery-oriented system of care. Given how we define recovery, a system of care that supports that kind of recovery. This is a definition that comes out of, actually he's a national figure around recovery, Bill White. And I've adapted a little bit because, again, he came out of substance abuse, but I think this moves beyond that to just chronic diseases in general. So the definition goes, systems of health and human services that affirm hope for recovery, exemplify a strength-based orientation, and offer a wide spectrum of services and supports aimed at engaging people with chronic health conditions into care and promoting their resilience and long-term recovery, for which they and their families may choose. There are a couple key words that come out of this for me: strength-based and choice. If we're going to provide individualized care, the system has to offer various options of care and treatment so that individuals can choose what works best for them, given their individual needs. And so this definition has been out there now for a number of years. Our major funder, SAMHSA, Substance Abuse and Mental Health Services Administration, has taken on this definition on recovery within the way they're operating, and they're funding activities and programs supporting recovery. So that's what's happening on our end. And again, those resources are in your pamphlet. You can find information, toolkits, etc. there. So this is what we're moving towards. And again, I mentioned my observations around data. And the last thing I'm going to do is ask you to bear in mind a couple of things. When you leave here, we talked about this integration, what that means, recovery-oriented system of care. Think of 3 things when you leave here as you network with individuals. But the first is coalition building. When you leave here and go back to your agency, to your country, who can you pull together on your team to assist you in immigration efforts moving forward? You can't do it alone. And we're talking about all of these other fields as well. You've got to pull folks into your team. So what can you do around coalition building? Also, think about the anticipated impact on your organization. If you can think about what this means or will mean to your organization, you have a better sense of who to bring to the table and how to address those needs. And thirdly, awareness raising. How can we raise the mantle about the fact that we cannot treat folks in these siloed systems, but within our integrated approach? So with that said, I'm going to finish up. A few reminders. If you haven't completed an evaluation form, please do that up front. Part of our funders, our responsibility to our funder is to have these evaluations completed and submitted. Our event ends at 8:30. We're running a little behind schedule, so thank you for being patient with us, but there will be shuttles. Orange form? Okay, there's an orange form in your packet to fill out as well. The shuttle, we have shuttles coming in at 2 times, one at 8:30 and one at 8:45. Sure. So this is the form we mentioned. Shuttles will be here at 8:30 and 8:45. And I'd like to thank our speakers again for being here and for presenting this evening. And what I would like to do is ask Minister Samuel to give a few closing remarks for us as we close the session out. And you guys can go ahead and network. There's food and drinks in the back. I thank you again for being here. Minister Samuel.
Pleasant good evening, everyone. I'm elated to be here, Excellency, Dr. Green, all of the invited guests here. One of the things that is fantastic in Trinidad and Tobago is the fact that besides the Ministry of Health having the responsibility to look at treatment and care, HIV, the leadership of HIV, and the coordination and the direction of HIV in Trinidad and Tobago remains under the remit of the Office of the Prime Minister. And in Trinidad, I'm responsible as a Minister of State in the Office of the Prime Minister for where we take or what we do with HIV and how we direct the future with regards to HIV. So it is not just the Ministry of Health that has the remit, but the Office of the Prime Minister remains integrally the body that is responsible for where HIV goes and how we approach it. We at this time are at the crossroads. We are at the assessment period in Trinidad and Tobago. We are revisiting what we have done, seeing how we have done it, seeing where it has failed, how it has failed, why it has failed. And then the things that are good, we are assessing it to see how it could be better and where we can take it in the future. So we are about to reload, and if it's from a gunner standpoint, a weapon standpoint, when you go to the range, what you do is that after you're fired, you've got to reassess how you're fired, and if you have fallen short, if you have hit the bullseye, where you are, and if you're not there, you've got to readjust your sights again, take aim again, and fire again. We are about to take aim again. So we are assessing where we are if we have fallen short, where we have hit, if we have fallen short of the target, what will cause us, what has caused it, and now we're about to reload. If it was a driving situation and we were into race car, we would have pulled up it to the mechanics again to assess and clean up the engine and change tires again and get ready to roll again, and that's where we are in Trinidad and Tobago. But I want to encourage all of you that if we pool our thoughts together, if we regroup, when we regroup, then together we can become tremendously victorious. And we can conquer this thing that would have tried to conquer us in the past, would have tried to destroy lives in the past. We have come this far, but we have not won as yet. And we've got to start to think and have this word, victory, in our minds, in our sights. So right there, we've got to say that we will conquer this thing and that we will not allow ourselves to be conquered by it. Yet we must not take it for granted, but we must realize that we are in a war. And I like to say we're in a war, not against persons, but against virus. And that this war we are in is to be victorious and to ensure that down the road, lives and people who live with HIV will continue to be victorious, and this world will be victorious, and we in this region will then teach the rest of the world how to be victorious, because we are resilient people. God bless you.
Ladies and gentlemen, go ahead and mingle, but before you go, on your behalf, I'd like to ask Ryan for his presentation We will place that on the PANCAP website, www.pancap.org. You can access that once it gives that to us, and all other relevant information you need, up-to-date information about the region. We want to thank all of you for being here. We want to thank the Danya Institute. We want to thank the government and people of Trinidad, the Republic of Trinidad and Tobago for hosting us this evening. God bless all of you. Network, share, learn, teach. Thank you, ladies and gentlemen. Have a good evening.